This is video history from the J. Bay Jacobs Library for the History of Obstetrics and Gynecology in America. And my guest this afternoon is Dr. Martin L. Stone, who's professor and chairman of the Department of Obstetrics and Gynecology, State University of New York at Stony Brook. It's a warm, sunny April afternoon in the year 1987 in Las Vegas, Nevada, and we have a pleasant chance to chat with one of the longtime leaders of our specialty. Marty, as promised, let me start by asking you to tell me about your career, where you began, and your education and the academic ranks and roles that you've held.
I'll do it as quickly as possible. I'm a son of a family physician, in those days called a general practitioner. Went to undergraduate school at Columbia, medical school at New York Medical, served some time in the Army, fortunately was assigned to obstetrics and gynecology, started out as academic full-time at the New York Medical College.
In what year was that?
In 1949. Started out as instructor. It might be interesting to note I was paid $1,200 a year and free office. And of course I was allowed to have an academic practice within the institution. Finally became professor and chairman and stayed there for 25 years as professor and chairman. I was 35 when I started. For reasons that are not germane, I decided to leave there and went out to the new school to build a new department to see if it could be done again at the State University at Stony Brook, and now I've been there 8 years.
What year did you become chairman at the New York Medical College?
55.
At age 35 was a young start.
Young start. And watched it, the specialty develop in very interesting ways. Saw it reach its peak, I think, in the 60s and 70s, and have lots of concerns about the 80s, 90s, and the year 2000, as did the governor in his speech.
When you started in 1955 as the chairman, how big was your full-time faculty?
I had 2 other people, and the clinical staff is 60. But I had women in the program at that time, minorities in the program. I didn't know it was fashionable. They were the best applicants at the time. And the staff grew, of course, as everybody's staff did.
If you could do the job with 3 full-time faculty in 1955, why does it take 25 today?
Well, you have to be careful when you reach my age that you don't sound like a prehistoric animal that, if he doesn't change, will become extinct. People don't want to work as hard today.
Even including faculties?
Very much including faculties. There's a new syndrome called stress. Stress in residency, stress in work. I think that there is stress. When I did a Scanzoni rotation with a resident pushing from above and my foot up on the delivery table and pulling from below, I was stressed. But that's what I was in it for. I enjoyed doing that. I think at Stony Brook they've seen one Scanzoni that I happened to do a night I was on. Otherwise nobody does that anymore.
Before pursuing more things academic, let me hark back for a minute to your background in ACOG. You were president in 1978.
I'm glad you're here. I couldn't remember the year.
How did you start out in organized obstetrics and gynecology?
I started out at the district level with Denon of the forceps fame as my mentor in New York, and Hughes from up in Syracuse as the 2, and Clyde Randall. They were the 3 that got me involved at the district level. I was district secretary and then district chairman, and then I served a long number of years as secretary of the college.
What year were you secretary?
Well, it's somewhere before I was president, for 6 years, 2 terms. Of course, served in all the committee functions when I went off the executive board, and then was honored by being nominated for the presidency, and continued to be as active as I can be in the college activities. If I think of one of my biggest achievements, for which, along with you and only a few others at that time, were committed, and that was the move from Chicago to Washington.
Tell me a little bit about the background of that. Surely the notion, and accurately, the notion started during the time you were president,
yes.
and we just opened a small office there. How do you remember it went?
Well, I remember the office went surprisingly well, and it was Erwin Nichols, who was down in that office and said it was great, and we ought to look at really being there, and you were for it strongly, but felt we had to really investigate. We had a special committee that studied it, all kinds of plans. The fear on the part of the anti-Washington people was the catch buzz phrase, would get Potomac fever. If we did, I'm glad we did. And we had argued that one group should get Potomac fever, and the educational component of the college activities would go on no matter what the city was. And that is indeed proven to be true. And now I look at the plans for this magnificent building. It's nice to see that you were right in your original thought. It's been a great move. Well, not singly, as I say, there were lots of us that were involved, but there were more that were opposed at the time. That was significant.
In the time since you've been president, I know you've been on the Residency Review Committee. What other things have kept you active in an organized fashion?
The college activities, the main one that has been most enjoyable and I think productive was the Liaison Committee, both the small one with the American Board to solve or prevent problems before they occurred, and the large one which is made up of representatives from all the organizations, with the college having been one of the main sponsors. And that replaced the old national committees, 3 or 4 of which died. This has persisted and progressed and has been productive. Outside of the college, I've been active with APCO. I was the first vice president, one of the organizing members of APCO.
Among the 8 people who organized APCO in 1962.
That's right. I just this year did the program for the APCO meeting in New Orleans. And if there's another distinction, I'm one of, I believe now, 2 living fellows, but you may have the names, who have made every one of these annual clinical meetings since the Academy started. The other fellow is a retired...
Dr. Mendoza,
and I saw him here this meeting. And we've made every meeting that there's been. Yes, indeed.
Now, I think.
And it's grown appropriately, and it's quite a production. I happen to believe that the fellows of the college are the ones to be congratulated, because while it's still voluntary, they sure make sure that they go and take postgraduate courses. And I think they probably find that a very important part of the annual clinical meeting, as well as the other courses they take in other times of the year.
Let me hark back to something that you mentioned, the Liaison Committee for Obstetrics and Gynecology. And as you pointed out, back in the late 60s and early 70s, there were perhaps 3 so-called national councils which arose and flamed and fired right out again. I
guess it's worth mentioning all this for history.
Mm-hmm. What's the present Liaison Committee started in 1975, and I know you've been very active in it for the past several years.
Just one office chairman.
What's it doing, and why is it important?
What it's doing is bringing together representatives from essentially every recognized important society in our discipline for twice a year meeting with an agenda well thought out in advance, and with many of the significant issues facing especially being discussed at the meeting, but also with white papers prepared on specific topics. A lot of thought about all the issues facing us. I think it saved innumerable arguments, probably prevented more journals from being published, more organizations from being formed, and has been a very cohesive force in furthering the aims of the specialty.
Overall, I think people have had the perception that OBGYN and in addressing education and organization perhaps has had a leg up on a number of the other specialties.
I think, as I said in academics now at 2 schools, that OBGYN is really ahead of a lot of the other disciplines in being concerned about residents, in being concerned about undergraduate education. And maybe that's why we have so many OBGYN men who are deans, because the number's increasing all the time.
Well, let me hark back to you personally and ask you some things about your your academic career and the teaching part of it. Starting by asking you that in the 25 years at New York Medical College, what are you most proud of having accomplished there?
The number of students that I attracted to OBGYNs especially, the national average has always been between 5 and 7%. We've run as high as 20 to 22%. It seems they're all here.
Yeah, how'd you do that? Why did and I think it's a well-known fact. Why did so many students from the New York Medical College go
on
into
my
OB?
humble days, I say it's because the other departments were so bad that we stood out. When I don't feel so humble, I think it's because we were interested in undergraduate education. And to this day, in many places, including some of my current faculty, they're superb subspecialists. They give great clinical care and are doing their research, but they don't want to teach. And they find that an added chore that they'd like to get out of, or send their fellow or something. And we insisted that that's what we were paid for by the college, was to teach. That's what gave us the academic title. And the others followed out of that. And this, I think, proved to be very sound. A society was formed, the Obstetrical and Gynecological Society of New York Medical College, and then on the 20th anniversary of my being chairman, they changed the name to the Martin L. Stone Society. And we meet twice a year. One is a scientific meeting, postgraduate course, and one is at the annual clinical meeting. And we had our reception last night with about 100 people there. They just come back every year from somewhere. Since I won't get the Nobel Prize, it's nice to know that I will leave a legend or creation behind, and that's all the students.
What teachers should do, isn't it?
Is teach. It's not a dirty word, but I still tell you that I even think APCO is not paying enough attention to undergraduate teaching. There's no one, and the college pays less to that than other things, I think appropriately. They're involved in continuing education, its fellowship, and the practice problems of its fellows. APCO, I get the feeling, is going to look at it a little more. Even the deans are. We're now having discussions of putting the fourth year back in the medical school, since the current fourth year, as you well know, is a travel year. Auditioning, they call it, for residency.
Looking for residency.
Yes. And we as a discipline have spotted that and wanted to change it, but one especially can't do it if the others aren't. The deans will have to do it by saying, come back, come home again.
In 1980, when you went to Stony Brook, you had what's really, in this country, a unique opportunity, or
yes,
certainly unique to very few people. That is, there was a brand new medical school, essentially without a department of obstetrics and gynecology. You could do it exactly the way you wanted. What good things did you do that you learned over the 25 years?
Well, when the dean recruited me, I told him I would get him an approved residency, one of the measures that's important, give him a new curriculum for the students, attract the faculty, and have research going on.
A dean could hardly want more, right?
And I've done that, so perhaps it's time to move on to something else. The only thing that I missed, of course, I had, as we all do, outside forces play a role in how a department exists. I had to have my butterfly collection, one of every subspecialist at least. And generalist is a dirty word, and I can't convince people that they're the finest subspecialty there is, and we need more of them to make better department heads. But I was able to recruit. You've been to Stony Brook. It's a beautiful spot. The living is nice. The schools are good. Everyone has a boat, including the residents. I think some of the students must too. And we've recruited well. The service has grown quickly. As a matter of fact, on a spot survey for some outside agency just last week, 34% of the discharges at the Hospital of Obstetrics and Gynecology. It continues to grow.
What sort of curriculum that you put in terms of time and clerkship length and so on when you have the chance?
It isn't particularly new or innovative because I don't think education has changed. Techniques available to us, some of the newer technology helps of using computers and other study methods. But the curriculum per se was, number one, we teach examination, female patient in the first year. Not unique, but didn't exist in many places. Since no one else wanted to do it, we use surrogate patients and teach both male and female general examination. And it's their first exposure. They wear white coats. It's except for when they're interviewed to get into med school, it's the only other time they look good in the 4 years, their first exposure to patients. Then in the second year, we have a integrated systems teaching program, but I have one whole block that's reproductive medicine that goes for 3 weeks. And we include in that GYN pathology and a couple of other smaller departments that can only fit in there. And then we have a 6-week clerkship. We have printed our own syllabus for both the introduction to medicine and the clerkship. Since we use some other hospitals for the clerkship, and they can be uneven in any part of the country, everyone gets a core before they go out on the clerkship, a 3-day core, so that they all get the same background material. And if they get additional teaching or different kind of teaching in the individual hospital, that's just icing on the cake. And then in the senior year, we have electives, and we have a program out there that gives we have both an MD, PhD program and an MD with distinction, for which they must do research. And we have, in this year's graduating class, and they don't all go in OBGYN, but we have taking the program in our department, 6 students for the MD with distinction. Only 3 of those 6 are going in OBGYN. Since we've been there, we've always matched in the, for our residents, but just as significant, we've been 100% successful in having Stony Brook students match. And for that, we do a lot of counseling. And it's, again, something I think is a continuation of being interested in the students. And the biggest part of the counseling is to try and, it's like a dating service, have them go where they will get rather than aspire to what they think is the best, and they won't even be considered. And that's worked very successfully.
Of all the things that you've done, Marty, over the years, which would you say you'd most like to be remembered for?
I think I'd say whatever contributions I've made to education. Of the importance of jobs, positions, honors, President of the college is far and away the most significant that I'll remember. The contribution that you make on a real practical basis is working on the residency review committee. That's, I don't know if people realize what a significant assignment that is for protection of the residents again, to see that they don't go somewhere where there's no education. And those are the 2 biggest I've had.
It's been great to talk with you, Dr. Martin Stone, past president of the college, distinguished academician, and a man who obviously believes what he says. He's a teacher. Marty.
Thank you.